What is an example of a courageous situation you have dealt with?
In a recent encounter in a crisis intervention chat room, I faced a situation where a distressed individual was contemplating self-harm due to intense feelings of loneliness and hopelessness. My task was clear: provide immediate support and help guide the person from harming themselves, while encouraging them to seek professional assistance if needed. To address the situation, I started by actively listening to the person, acknowledging their emotions, and letting them know their feelings were valid. Through empathetic conversation, I aimed to offer reassurance and hope, while gently challenging their negative thoughts. I also provided information about local crisis hotlines and mental health resources, empowering them to take further steps toward getting help. The outcome was positive. The individual expressed gratitude for the support received and seemed calmer. They even mentioned feeling more hopeful about their situation and agreed to consider seeking professional therapy. Ultimately, they agreed to contact a local mental health hotline for additional support. Reflecting on this experience, I believe that timely intervention and compassionate communication were key factors in de-escalating the crisis and helping the individual move towards a more positive path. In conclusion, by listening actively, empathizing genuinely, and providing practical support, I was able to assist someone in a crisis, emphasizing the importance of compassion and effective intervention in managing mental health challenges.
Could you describe a situation where you were able to influence a patient's behavior or circumstances positively?
In a healthcare setting, I came across a patient who showed hesitance in showering regularly, which was impacting both their personal hygiene and overall well-being. I was assigned the task of motivating the patient to overcome their reluctance to shower and establish a consistent hygiene routine for their own well-being and comfort. Understanding the patient's reluctance, I approached the situation with empathy and understanding. I took the time to listen to their concerns and reasons behind their reluctance to shower. Through open communication, I addressed any underlying fears or anxieties they may have had about showering. To encourage positive behavior change, I employed motivational interviewing techniques, focusing on the benefits of good hygiene and how it contributes to their overall health and self-esteem. I also provided practical support, such as offering to assist with gathering toiletries, or adjusting the shower environment to make it more comfortable for the patient. Over time, the patient began to show improvement in their showering habits. They gradually became more willing to participate in personal hygiene activities and started showering regularly. As a result, their overall sense of well-being improved, and they reported feeling cleaner and more confident. Reflecting on this experience, I believe that taking a patient-centered approach, coupled with empathy and encouragement, was instrumental in facilitating behavior change. By addressing the patient's concerns and providing support, I helped them overcome their reluctance to shower, leading to positive outcomes for their health and quality of life.
What will you do if you are incompetent to do the procedure?
In a healthcare setting, I found myself faced with a procedure that I lacked the competence to perform safely and effectively. My job was to handle the situation properly and make sure that someone with the right skills and experience carried out the procedure. Recognizing my limitations, I immediately communicated my concerns to the appropriate authority, such as a supervisor or a more experienced colleague. I explained the situation honestly, emphasizing the importance of patient safety and the potential risks associated with my lack of proficiency in performing the procedure. To mitigate any potential harm to the patient, I offered to assist in other ways, such as preparing the patient for the procedure, providing support during the process, or managing any documentation or logistics associated with the procedure. By promptly acknowledging my limitations and seeking assistance from qualified individuals, I ensured that the procedure was carried out by someone with the requisite skills and expertise. This approach prioritized patient safety and prevented any potential harm or complications that may have arisen from my inability to perform the procedure competently. Reflecting on this experience, I believe that being honest about my limitations and seeking help when needed is crucial in a healthcare setting. It underscores the importance of collaboration and accountability in providing high-quality patient care.
How will you manage patients from the ICU without documentation?
I found myself in a challenging scenario where patients from the intensive care unit were without proper documentation, posing a significant obstacle to their ongoing care and management. My responsibility was to make sure these patients got the right care promptly, even though there wasn't enough documentation, and to deal with any possible risks or issues related to incomplete medical records. Understanding the urgency of the situation, I immediately initiated a systematic approach to gather essential information about each patient. I consulted with ICU nurses and other healthcare team members to obtain relevant details regarding the patient's medical history, current medications, treatment plans, and any recent interventions or changes in their condition. In addition, I conducted thorough assessments of each patient, paying close attention to vital signs, symptoms, and any observable signs of distress or deterioration. I also engaged directly with the patients and their families to gather additional information, including past medical history, allergies, and personal preferences. Utilizing available resources such as electronic health records, communication with other healthcare facilities, and collaboration with specialists, I pieced together as much comprehensive information as possible to guide the patient's ongoing care. Despite the initial challenges posed by the lack of documentation, my proactive approach and collaborative efforts enabled the patients to receive appropriate and effective care. By gathering essential information from various sources, and conducting thorough assessments, I ensured continuity of care and minimized the potential for adverse events or delays in treatment. This experience highlighted the importance of adaptability, collaboration, and critical thinking in managing patients without documentation in the ICU. While the lack of proper documentation presented challenges, proactive communication, resourcefulness, and a patient-centered approach were instrumental in overcoming these obstacles and delivering high-quality care.
How will you support junior staff?
I encountered a situation where I was required to assist junior staff members grappling with their tasks and responsibilities. My task was to provide guidance, mentorship, and support to help junior staff members develop their skills, overcome challenges, and excel in their roles. To address this task effectively, I first took the time to understand the specific areas where the junior staff members were experiencing difficulties. I engaged in open and honest communication with them to identify their concerns, goals, and areas for improvement. Next, I tailored my approach to provide individualized support based on each staff member's needs and learning styles. This involved offering constructive feedback, sharing relevant resources and educational materials, and demonstrating techniques or strategies to enhance their performance. I also encouraged a culture of collaboration and teamwork, fostering an environment where junior staff felt comfortable asking questions, seeking assistance, and sharing their experiences with their peers. As a result of these efforts, the junior staff members began to show improvement in their performance and confidence levels. They demonstrated a greater understanding of their responsibilities and were better equipped to handle challenges independently. Moreover, the supportive and nurturing environment fostered a sense of trust and camaraderie among the team, leading to increased morale and job satisfaction. Supporting junior staff members is not only essential for their professional development but also contributes to the overall success and effectiveness of the team. By providing personalized guidance and fostering a culture of collaboration, I was able to help junior staff members overcome obstacles and thrive in their roles. This experience reaffirmed the importance of mentorship and teamwork in achieving organizational goals and promoting individual growth.